Chapter 22. Ingested poisoning is usually accidental in children and deliberate in adults. Opioids, sedatives, and barbiturates they slow the breathing, so ventilatory complications are a concern with such poisonings. You should be prepared to provide aggressive ventilatory support and CPR if necessary to a patient who has ingested an opioid, sedative, or barbiturate, each of which can cause depression of the central nervous system and slow breathing. When dealing with an absorbed poison, you should flush the skin of the affected area with clean water for 15 to 20 minutes. Most poisons do not have an antidote. Sympathomimetic and anticholinergic overdoses are similar in that patients may be agitated and have tachycardia and dilated pupils. Which of the following statements is true about the use of activated charcoal in treatment poisoning? Two things. Before you give a patient charcoal, you must obtain approval from medical control, and if the patient has a decreased LOC and cannot protect his or her airway, do not give activated charcoal. You are assessing a 28-year-old patient and you notice he has pinpoint pupils. You suspect a drug overdose. What drug is likely the cause of this phenomenon? Out of the choices, the answer is heroin. Which of the following might make it difficult for you to establish IV access in a patient with drug abuse problem? Venous scarring. You're assessing a patient who presents with slurred speech, hypoventilation, and hypotension. Which of the following might the patient have taken? Out of these options for meds, diazepam. Which is the most common route of poisoning? Ingestion. What should you give a patient displaying respiratory depression and hypotension? Naloxone. Which of the following is a CNS stimulant? Sympathomimetics. Antihistamines are an example of a anticholinergic agent. You can use the mnemonic dumbbells to remember the signs and symptoms of cholinergic agent poisoning. Which type of food poisoning results from an organism? Salmonellosis. For which of the following would you use a duodote autoinjector? Sarin gas attack. A hypnotic drug is one that induces sleep. A patient who presents with rapid breathing, nausea and vomiting, ringing in the ears, and hyperthermia should be suspected of ingesting aspirin. Activated charcoal may be indicated for a patient who has ingested aspirin. After administering activated charcoal to a patient, it's important to be alert for vomiting. An EMT's primary responsibility to the patient who has been poisoned is to recognize that a poisoning occurred. Heroin is an example of an opioid. Hypotension, hypoventilation, and pinpoint pupils would be expected following an overdose of oxycodone or Percocet. If you are uncertain how to treat a patient who has been poisoned or exposed to a specific substance, you should try to find the container the substance was in. Most poisonings occur in the blank route, ingestion. Signs, symptoms of a sympathetic drug overdose include tachycardia. The major side effects associated with administration of activated charcoal is black stools. What type of poisoning will cause burns around the mouth in children? Alkaline poisoning. Which of the following questions would be least pertinent during the initial questioning of a patient who ingested a substance? Why was the substance ingested? Which of the following statements regarding the Salmonella bacteria is correct? The Salmonella bacterium itself causes food poisoning. Your priority in caring for a patient with a surface contact poisoning is to avoid contaminating yourself. Cholinergic agents, medications that overstimulate the normal body functions controlled by the parasympathetic nervous system. Dumbbells stands for diarrhea, urination, meiosis, bradycardia, emesis, lacrimation, seizures. Sludgem stands for salivation, lacrimation, which is excessive tearing, urination, defecation, drooling, diarrhea, gastric upset and cramps, emesis, muscle twitching. Chapter 23. Schizophrenia is a functional disorder. That is, a disorder where there is no known physiologic reason for the abnormal functioning of an organ or organ system. When restraining a patient, which of the following is true? Use the minimum force necessary to control a patient, and EMS protocols should avoid the use of hard restraints. Obsessive compulsive disorder is classified as which type of psychiatric disorder? Anxiety. Where should you begin the primary assessment of a patient displaying a psychiatric issue? From a distance. When assessing a patient with a behavioral issue, you need to ask questions about 3 contributors: proper CNS functioning, whether the patient took hallucinogenic or other drugs or alcohol, and significant life changes. What is the concern with transporting a patient who is restrained with his or her hands tied behind the back? There is a risk of positional asphyxia. Which of the following is a sign or symptom of PTSD? Hypervigilance. How is behavioral crisis defined? Any reaction to events that interferes with the activities of daily living. Which of the following behavioral crises is most likely to lead to suicide? Depression. Which of the following statements is true regarding the returning veteran? A person's altered consciousness can allow him or her to continue functioning under negative conditions. As an EMT, what's your main goal in a psychiatric emergency? Diffusing/controlling the situation and providing transport. In which condition is a patient likely to have a flashback? PTSD. Blank is what you can see of a person's response to the environment. Behavior. A physiological disorder that impairs bodily function when the body seems to be structurally normal is called a functional disorder. A technique used to gain insight into a patient's thinking, which involves repeating in question form what the patient has said, is called reflective listening. Common causes of acute psychotic behavior include all the following except Alzheimer's disease. General guidelines for managing a patient with a behavioral emergency include being prepared to spend extra time with the patient. Immediately after physically restraining a violent patient, the EMT should reassess the patient's airway and breathing. In which position should you restrain a physically uncooperative patient? Supine. People at risk for suicide include all the following except married males older than 30. Post-traumatic stress disorder can happen after exposure to or injury from a traumatic occurrence. Signs of excited delirium include diaphoresis, tachycardia, and hallucinations. The first step in assessing a patient with a behavioral emergency is to ensure your safety. The single most significant factor that contributes to suicide is depression. The term behavioral crisis is most accurately defined as a situation in which a patient of any age exhibits agitated, violent, or uncooperative behavior. You may not be able to determine whether a person has a mental illness, but you can't predict the person's likelihood of becoming violent. Which of the following is an example of functional behavioral disorder? Schizophrenia. Chapter 24. Symptoms of gonorrhea are generally more severe in men than women. True. With gynecologic patients, you should leave any foreign bodies in place after stabilizing them with bandages. True. Pelvic inflammatory disease is the most common vaginal infection in women 15 to 44. True. The most common presenting sign of PID is generalized lower abdominal pain. True. What is menarche? The onset of menstruation, which typically occurs between ages 11 and 16, but may occur either earlier or later. That word might be menarche. Menarche. Which of the following control the process of ovulation and menstruation? Ovaries. You are assessing a female patient who tells you she feels blood coming from her vaginal area. She gives you permission to look and you observed moderate bleeding from the vagina. What should you do to manage the bleeding? Place a sanitary pad over the vaginal opening. If PID is not treated, which complication can occur? Ectopic pregnancy. You're assessing a 38-year-old woman who reports achy abdominal pain, burning on urination, and a slight fever. As you assist her to the ambulance, you notice that she has a shuffling gait. Which condition does this indicate? PID, pelvic inflammatory disease. In the case of a sexual assault, what's your most important treatment option? Psychological support. In addition to providing medical care to a rape victim, which of the following is the most critical thing you should do? Move the patient to a private location. What should you do when a female patient has unknown vaginal bleeding? Treat for shock. What is an EMT's responsibility regarding evidence in the case of a sexual assault? Preserve. Why is it important to transport a sexual assault victim to the hospital, even if she does not have any obvious injuries? The patient may have injuries that were not detected in the field, such as internal bleeding, and have a delayed onset of symptoms. As a woman approaches menopause, her menstrual periods may become irregular and vary in severity, each ovary produces, this is like copied down wrong. Each ovary produces an ovum in alternating months and releases it into the fallopian tube. Sorry, that's worded wrong, but maybe you can use it. Fallopian tube. Each ovary produces blah blah fallopian tube. EMTs receive a call for a possible sexual assault. The patient is a young female who is conscious and alert and has no apparent injuries. She states, "I can't remember anything, but I know I was raped." The EMT should suspect that the patient was given a drug prior to the incident. General treatment for a woman with vaginal bleeding and shock following sexual assaults includes all the following except carefully removing any foreign bodies from the vagina. In anticipating of receiving a fertilized over the lining of the uterine wall, becomes engorged with blood. Sorry, that one's copied wrong again. It's common for young females who experience their first menstrual period to experience abdominal cramping, which may be misinterpreted. Potentially life-threatening consequences of pelvic inflammatory disease include ovarian, abscesses, and ectopic pregnancy. The onset of menstruation usually occurs in females who are between 11 and 16 years old. The physical examination of a sexual assault victim should be limited to a brief survey for life-threatening injuries. When a woman presents with abdominal pain or other vague symptoms, the EMT is often unable to determine the nature of the problem until he or she has gathered patient history information. When caring for a woman who is experiencing a gynecologic emergency, the EMT's main focus should be to maintain her ABCs and transport without delay. When documenting a call in which a female was assaulted sexually, you should keep the report concise and record only what the patient stated in her own words. Whatever possible, a sexual assault victim should be given the option of being treated by a female EMT. Which of the following conditions would most likely lead to pelvic inflammatory disease if left untreated? Chlamydia. Which of the following statements regarding pelvic inflammatory disease is correct? PID can scar the fallopian tubes, which increases the risk of an ectopic pregnancy. Chapter 25. You're assessing a 10-year-old boy who fell out of a tree. Your evaluation of the MOI would concentrate on which of the following? Pick 3. The height from which the child fell, the surface onto which the child fell, the part of the body that struck the ground first. Arrange the steps in the decision scheme for field triage of injured patients in the correct order. First, measure vital signs and LOC. Next, assess the anatomy of injury. Next, assess the MOI and evidence of high energy impact. Last, transport. Which of the following factors has the greatest impact on risk of injury? Speed. In which type of vehicle crash are you most likely to find a patient with whiplash injuries? Rear end. The phenomenon in which the rapid changes in tissue and fluid pressure that occur with the passage of a projectile result in serious injury to internal organs distant to the actual path of the bullet is known as cavitation. What type of blast injury occurs when objects are propelled by the force of the blast wave and strike the victim, causing injury? Secondary. What level of trauma center provides prompt assessment, resuscitation, and stabilization of injured patients and emergency operations? Level 3 trauma center. Glasgow Coma Scale for your review. You're assessing a patient who opens her eyes when you speak to her, who can respond to you but seems confused as to time and place, and who localizes pain. What's her Glasgow Coma Scale score? Score 3 for eye opening in response to sound, 4 for confused conversation, and 5 for localized pain, so she gets 12. The revised trauma score is calculated by assigning a coded value 0 through 4 to the Glasgow Coma Scale, systolic blood pressure, and respiratory rate. If somebody has a Glasgow Coma Scale of 12, falls in the range of 9 to 12, so she has a coded value of 3. The systolic blood pressure is 81, falls in the range of 76 to 89, so has a coded value of 3. The respiratory rate's 22, falls in the range of 10 to 29, so has a coded value of 4. So the total is 10. You would most commonly use the revised trauma scoring system for a patient with the potential for what type of trauma? Head trauma. At what step in the ACS-COT/CDC updated field triage decision scheme would you assess the mechanism of injury and evidence of high energy impact? Step 3. According to the American College of Surgeons Committee on Trauma, an adult trauma patient should be transported to the highest level of trauma center if he or she has a GCS score of less than or equal to 13 with a mechanism attributed to trauma. Evaluation of the interior of a crashed motor vehicle during extrication will allow the EMT to identify contact points and predict potential injuries. Factors that should be considered when assessing a patient who has fallen include all the following except the speed of the fall. Force acting over a distance is the definition of work. If one or more occupants in the same vehicle are killed in a crash, the EMT should suspect that all living occupants experienced the same serious trauma. In contrast to a Level 3 trauma center, Level 1 trauma center must have general surgeons in-house 24 hours a day. Internal injuries caused by a gunshot wound are difficult to predict because the caliber because the bullet may tumble or ricochet within the body. Signs of a pulmonary blast injury include coughing up blood. The index of suspicion most accurately defined as your awareness and concern for potentially serious underlying injuries. When assessing an injury of an elderly patient who fell, it's important to remember that osteoporosis can cause a fracture as a result of a fall from a standing position. When the speed of a motor vehicle doubles, the amount of kinetic energy quadruples. When treating a patient who experienced a pulmonary blast injury, you should avoid giving oxygen under positive pressure. Which of the following findings would be least suggestive of the presence of high energy trauma? Deployment of the airbag. Which of the following interventions is most critical to the outcome of a patient with multi-system trauma? Rapid trauma transport to a trauma center. Which of the following would most likely occur as a result of the second collision in a motor vehicle crash? Deformed steering wheel. Chapter 26. Hypoperfusion occurs when blood volume is significantly diminished and the system fails to provide sufficient circulation to the body. Place the steps in order of criticality. Control bleeding, address ABCs, treat for shock, assess for decap BTLS. Which of the following should you do when applying a tourniquet? 2 things. Place the tourniquet proximal to the injury, in the axillary region for upper extremity regions, and at the groin for lower extremity injuries. And make sure the tourniquet is tightened securely. Which of the following are key to the formation of blood clots? Platelets. At what point do cells in the brain and spinal cord start to die without constant perfusion? Within 4 to 6 minutes. In general, at what point will the adult body stop tolerating acute blood loss? 20% of total blood volume. The condition in which low blood volume results in inadequate perfusion is called hypovolemic shock. Which type of bleeding is characterized by a bright red color and spurting? Arterial. Which of the following would be the first sign of hypovolemic shock? Anxiety. You determine that your patient is experiencing internal bleeding. What should you do first? Administer oxygen. Which condition is likely when signs of hypotension, tachycardia, and cool clammy skin are found. Shock. What should you do first to control external bleeding in an extremity? Apply direct pressure. You are assessing a patient who is bleeding from the ear, which gives you a high index of suspicion that he has a skull fracture. How would you address this? Loosely cover the site. A fractured femur can result in the loss of blank or more blood into the soft tissue of the thigh. 1 liter. Bleeding from the nose following a head trauma is a sign of skull fracture and should not be stopped. Capillaries link the arterioles in the venules. Early signs and symptoms of interabdominal bleeding include pain and distension. External bleeding from a vein is relatively easy to control because veins are under a low pressure. Gastrointestinal bleeding should be suspected if a patient presents with hematemesis. Hypoperfusion is another name for shock. Hypovolemic shock occurs when low fluid volume leads to inadequate perfusion. In non-trauma patients, an early indicator of internal bleeding is dizziness upon standing. Internal bleeding into a fractured extremity is most often controlled by splinting the extremity. Perfusion is most accurately defined as circulation of blood within an organ in adequate amounts to meet the body's metabolic needs. Significant vital sign changes will occur if the typical adult loses more than blank percent of his or her total blood volume, 20%. The ability of a person's cardiovascular system to compensate for blood loss is most related to how rapidly he or she bleeds. Which of the following body systems or components is the least critical for supplying and maintaining adequate blood flow to the body? The filtering of the blood cells in the spleen. Which of the following splinting devices would be most important or appropriate to use for a patient who has an open fracture of the forearm with external bleeding? Air splint. Chapter 27. A hematoma occurs when a large blood vessel is damaged and bleeds rapidly, but is a closed injury. True. You should never remove an avulsion skin flap, regardless of its size. Removing a flap could lead to contamination. True. When possible, ALS providers should administer IV fluid before the crushing object is lifted off the body. True. The goal of the inflammation phase of wound healing is the removal of foreign material, damaged cellular parts, and invading microorganisms from the wound site. True. For which injury would you use an occlusive dressing? Open neck injury. Which of the following factors will help you to determine the severity of a burn? All of the following: depth of the burn, extent of the burn, involvement of any critical body areas like face, upper airway, hands, feet, genitalia, pre-existing medical conditions. Which of the following situations are likely to produce injuries with an entrance and exit wound? 2 things. A do-it-yourselfer who touched a live wire while repairing a light fixture, or a 19-year-old who has been hit by high-caliber gunfire. Which of the following is the final stage of wound healing? Collagen production. You're assessing a 28-year-old male with a rigid cast extending the length of his left leg. The patient is complaining of pain on passive movement, and he's showing signs of impaired circulation. What do you expect? Compartment syndrome. You're assessing a patient who's been in a high-impact T-bone collision. She's bleeding from the abdomen, and you can see part of her large intestine outside her body. What is this type of injury called? Evisceration. You're treating an 8-year-old boy who fell while riding his bike on a gravel road. The wound on his arm is seeping blood and is about 7 inches long, and there's a lot of dirt and gravel in it. How should you treat this injury? Apply a sterile dressing. The severity of a thermal injury directly correlates with temperature, concentration, and what other factor? Duration of exposure. You're responding to a fight at a restaurant and find a man conscious and alert. His face is mottled with blisters and abrasions, and he has blood on his shirt. He tells you he was trying to stop the fight when he was hit in the face with scalding hot coffee and fell backwards over a chair. According to the rule of 9s, what percentage of the patient's skin surface is burned? 9%. The face is 9%. What is your first responsibility when treating a burn patient? Stopping the burning. Which of the following is true about electrical burns? They are always more severe than the external signs indicate. Which type of soft tissue injury is least likely to result in infection? Contusions on the left lateral chest. Least likely to result in infection. When using the rule of nines, which of the following do you need to include in your calculations? Full and partial thickness burns. A burn that's characterized by redness and pain is classified as a superficial burn. A closed soft tissue injury characterized by swelling and ecchymosis is called contusion. A hematoma develops when large blood vessels beneath the skin are damaged. All of the following body structures are lined with mucous membranes except for the lips. An abdominal evisceration occurs when organs protrude through an open wound. An injury that separates various layers of soft tissue, resulting in complete detachment or a flap of skin, is called a avulsion. Functions of dressings and bandages include all the following except immobilization of the injury. Functions of the skin include all the following except the production of key antibodies. In addition to severe bleeding, the most life-threatening complication associated with an open neck injury is an air embolism. In contrast to animal bites, the bite of a human carries with it a wide variety of virulent bacteria and viruses. What layer of the skin forms a watertight protective seal for the body? Epidermis. When treating a partial thickness burn, you should avoid the use of creams, lotions, or antiseptics. Which of the following is a severe burn in a 35-year-old patient? Circumferential partial thickness burn to the chest. Which of the following statements regarding the rule of 9 is correct? The anterior trunk of an adult is equal to 18% of the body surface area. You have applied a dressing and roller gauze bandage to a laceration on the arm of a young female during transport. She begins to complain of numbness and tingling in her hand. You should assess distal circulation and readjust the bandage as needed. Chapter 28. You're treating a patient with a facial injury that has a displaced eyeball from the socket. Which of the following actions are appropriate to take? 2 of them. Cover the eye with a moist, sterile dressing and cover both eyes to decrease sympathetic eye movement. Which of the following is true about posterior epistaxis? 2 things. More severe than anterior epistaxis and causes nausea and vomiting. What is a hematoma? A collection of blood within the tissues. Which of the following fractures is associated with bruising around the ears and blood coming from the nose? Basilar skull fracture. What is hyphema? Bleeding into the anterior chamber of the eye. You're assessing a patient who was hit in the face by a baseball bat. There are multiple contusions on the face and he reports double vision. His left eye does not track with his right eye. What should you suspect? A blowout fracture. It's caused by blunt injury to the bones around the globe. Suspect this in any patient who reports pain, double vision, or decreased vision following a blunt injury to the eye, near the eye. Which of the following are found in the middle ear? Anvil, hammer, and stirrup. In which instance would you consider removing an impaled object? When the object is impaled in the cheek and compromises the airway. What is an air embolism? A clinical situation in which a vein is punctured and air is sucked into the heart. Unequal pupils most likely indicate what type of injury? Brain. You are treating a patient with significant bruising to her face and a broken nose. She's conscious, but her level of consciousness is significantly altered and her breathing is labored. What should you do to manage this patient's airway? Insert an oropharyngeal airway. Which area of the body are you palpating if you feel subcutaneous emphysema? Neck. Bleeding from soft tissue injuries to the face is most effectively controlled with pressure dressings and chemical ice packs. Bleeding from soft tissue injuries to the face is most likely effectively controlled with direct pressure using dry sterile dressings. Frequent reassessments of the patient with face or neck injuries are most important because such injuries can affect the respiratory system. The Adam's apple is the part of the larynx that is formed by the thyroid cartilage. The conjunctiva are kept moist by fluid produced by the lacrimal gland. The cricoid cartilage is the only complete circular cartilage of the trachea. The eyeball itself is referred to as the globe. The lower jawbone is called the mandible. The mastoid process is located approximately 1 inch posterior to the external opening of the ear. The small, rounded, fleshy bulge immediately anterior to the ear canal is called the tragus. The term hyphema is defined as blood in the anterior chamber of the eye. The upper jawbones are called the maxillae. The white portion of the eye is called the sclera. What is the function of the sternocleidomastoid muscle? Allows movement of the head. Which of the following findings would be least suggestive of a head injury? Briskly constricting pupils when exposed to light. Chapter 29. Which of the following are signs of crushing triad? 3 things. Hypertension, bradycardia, irregular respirations. Which of the following acts as a shock absorber for CNS, the central nervous system? Cerebrospinal fluid. You're treating a patient who went face first through a windshield. She has extensive head injuries and is displaying hypertension, bradycardia, and Cheney-Stokes respirations. Which of the following should you expect? Cushing triad. You're treating a patient who might have a skull fracture. What should you do if a dressing you have applied to a head wound becomes soaked? Place a clean dressing over the bloody one. Cushing triad in a patient is a sign of what? Intracranial pressure. While performing a secondary assessment of a patient who was hit with a tire iron on the side of the head, you find a depressed area above the patient's left ear. This indicates that the patient could have what? An epidural hematoma. When securing a patient to a backboard, what area of the body should you secure last? Head. The time between an initial period of consciousness and a subsequent loss of consciousness is referred to as what? The lucid interval. You're reassessing a patient and you find that her left pupil is dilated and fixed. What does this indicate? Increased intracranial pressure. Battle sign is an indication of what? Skull fracture. A short backboard or a vest-style immobilization device is indicated for patients who are in a sitting position and are clinically stable. An epidural hematoma is most accurately defined as an injury caused by a damaged cerebral artery bleeding between the skull and dura mater. Coordination of balance and body movement is controlled by the cerebellum. In contrast to a cerebral concussion, a cerebral contusion involves physical injury to the brain tissue. Once a cervical collar has been applied to a patient with possible spine injury, it should not be removed unless it is causing problem managing the airway. Signs and symptoms that might be found in a patient who has experienced a concussion include nausea and ringing in the ears. The blank nervous system consists of 31 pairs of spinal nerves and 12 pairs of cranial nerves, peripheral. The central nervous system, CNS, is composed of the brain and spinal cord. The hormone responsible for the actions of the sympathetic nervous system is epinephrine. The ideal procedure for moving an injured patient from the ground to backboard is the 4-person log roll. The spinal cord is encased in and protected by the spinal canal. The tough, fibrous outer meningeal layer is called the dura mater. What part of the nervous system controls the body's voluntary activities? Somatic. When opening the airway of a patient with a suspected spinal injury, you should use the jaw thrust maneuver. Which of the following interventions may be used to help reduce intracranial pressure? 30-degree elevation of the head,